Welcome to The Lead Climb, the podcast where we break down the strategies that drive patient acquisition and growth in behavioral health. Hosted by Growth Sherpa Consulting, we bring you expert insights on digital marketing, admissions, business development, and more, so your treatment center, mental health clinic, or private practice can thrive. Whether you're a CEO, admissions director, or marketing pro, this is where you'll find the tools to scale smarter. Follow us up the mountain. Let's lock in.
Today I have Jordan Sheffield with Verified Treatment. Jordan, why don't you tell everyone a little bit about yourself?
Hey, thanks for inviting me today. Been in the healthcare space since 2012. Really found my space in admissions, fell in love with it. I've done some consulting. I've done a lot of Salesforce builds since then, all centered around marketing admissions. And I was asked to come to Verified Treatment. I was one of the first users and kind of testing, piloting the platform, being in admissions. And that really, I saw the difference, change and dialogue that was possible. And I remember in 2019, I was asked to come work for the company. And everything is just aligned from there. I've gotten to have a lot of really educated conversations, and what I hope is thought-provoking, what I hope is thought leadership in this space. And I also hope to grow eligibility, benefits, interoperability, integrations, just for where I see the market going, not only in behavioral health, but also in the medical space, where technology will be a huge player, and not only delivering data, but helping us to make better decisions. And so that's what drives me.
Awesome. And I think you and I met, it's probably about 8, maybe 9 years ago now, at a conference. Back when I had brown hair and no glasses. Abs was a wonderful time for me. And then I had kids.
Abs.
Yeah, good old days. But a lot's changed, man. More than that, but a lot's changed in the space. So interested in your take. So you've seen it from admissions, you've seen it from the verifying of benefit side of things. What have you seen change over the last 5 to 8 years in our space?
I think a big one is consolidation. You're seeing so many companies be swallowed by other companies. You don't have as many smaller facilities. You have a lot of bigger players. And I think the government wants to see more players, because it's so hard when you don't have entities. Let's just borrow from another vertical in the same area, hospitals, right? They would rather have 150 hospital systems than 5,000 different behavioral health facilities. So private equities really come in, and they're just playing the game of, are you doing it well enough, and are we going to absorb you? Can we make a profit to sell? The whole M&A thing is just gone bonkers. So I think that's where I see the future of the market going. As far as admissions, I've been able to see, now we have, of course, buzzwords, AI and digital marketing, and just all these, goodness, what Google's changed a lot. So I think technology is going to play a big part in how we access data and where we get it, and interoperability. I remember there's, the EHR is such a foreign concept. I remember people using CRMs. They were primarily Excel sheets, and the growth from that over the last couple of years. What have you seen? I mean,
yeah, I see a lot of the same. You're talking about consolidation, and it got me thinking to some of my previous industries before getting to behavioral health. And I think one of the promises that we had for consolidation was sophistication, right? So previous coming to behavioral health, I was working for a surgical implant company, and we got acquired by a very large international conglomerate, right? And as far as medical device companies go, this was fairly mom and pop. It was a $600 million deal, but it was a mom and pop $600 million deal, if you can believe that. But you look at the previous national sales meeting that I went to right before the acquisition, and the COO was sitting down with me for a dinner at an Arizona Diamondbacks game. And it's like, small and it's just loose and it is what it is. And then you fast forward a year or two down the road and you got sophistication out of it too. There were more systems. It was better technology. We had a new robotic arm that you're supposed to use in surgeries, and like all this new stuff was happening. I don't see that as much in our space. I see consolidation, but I'm not seeing the promise of sophistication
Yeah.
being fulfilled. And I think your team probably sees this more on the admission sides of things. From what I see with admissions, is a more desire to rush through the process instead of build clinical alliances. And for me, I have to assume, because I don't see a lot of the rev side of things, even when doing what we do, I'm not as dialed into like revenue collection, insurance collect, any of that stuff. Like that's a little more parallel to my side than just strictly bringing clients in and getting
Yeah.
the team built. I have to imagine that's doing more harm than good, right? Because you have a rushed first conversation with someone who's seeking treatment, and you have a lack of sophistication. You're probably having a harder time on the back end. You're probably having a hard time verifying insurance on the front end, getting those things
Yeah.
taken care of. I don't know if you've seen that.
I definitely feel that pain really well, because it's all segmented though. You have everybody, the CRM is just a CRM, the EHR is just the EHR, the billing company is somebody else, and they have their systems, and even us, we're the VOB. We have our own kind of mission, and that's kind of where you see in the future, right? You see with this interoperability where you can plug and play in any different system and any different tool, man. That's really where I'd like to see us go. Really being agnostic, right? Because the data speaks for itself. Um, Everybody's going to use some type of eligibility online. Some type of soft VOB. We do it a little differently. Like we actually have an aggregated report that is giving you more data. It's not just taking a validity and white labeling it and pushing it back into somewhere. It's deeper than that. That's kind of where we've been able to really find the behavioral health detail. That's made us popular in this field. And I think we can bring that same sophistication to other verticals, right? Just talking with just kind of give you an idea, right? Surgical, right? There are so many other areas that have those same pain points, right? They either have to sit on the phone, or it's high dollar, it's high risk, high reward. We're familiar with behavioral health space because it's such a passionate, compassionate call that needs to happen in order to pick up the phone, talk to somebody that's calling you. They decided to call. Now you have to talk them into what they didn't even know that they needed existed, right? And you have to kind of do it pretty seamlessly. Otherwise, you're just going to lose their attention, and they've gone, right? Now they're talking to somebody else, or they just decided they woke up and they felt great. Now they don't need treatment, or they convinced their mom that I'm going to be better. Here's how. And so I think the sophistication comes with the technology. With having everything a little bit more seamless. So I think that's where we're going to see ourselves, is maybe not being such a independent, web app, still having that maybe as an application, but that not being the only way. I really want to be any technology that you're using kind of available. Everything that we're writing right now is in different APIs to be thought provoking, to be available to plug and play. And it's if other people and other players are willing to play in the sandbox and maybe sacrifice revenue. I think that's been where I've seen a big pain point have being a vendor, is that everybody's trying to do everything right? And what I've seen, billing companies building EHRs, right? Are you going to be a good billing company? Are you going to be a good software company? Are you going to be both? Are you going to try to be both? And just allocating resources that it might be better spent elsewhere, right? Can you specialize in something and still work with other players in the field? And I think that's where innovation comes in. I love that, this is, it still can be innovative. And there are some really cool stuff coming to billing to give you some insights, on what we've seen, what worked well, what insurance companies do we like, and kind of having that real-time data while you're in the admissions call is huge, right? Having, you know, admissions knowing what billing sees without talking to billing, you're just wasting time there. I was talking to a guy today, and he was just saying that the verification process is one of those things where the conversation goes to die. And that's that natural part, the old way of phone verifications. It took so much time to get the person willing or to understand what they're going through. Oh, do you have insurance? Okay, great. And then, you may tell them a little about your program. We have 5 swimming pools. We're, 17 miles from the beach. You might get to go once while you're here.
In
Maybe,
February.
who knows? February, if you pass all, 17 tests. You just never know, right? You can posture it any way you want on that sales call and that admissions, which is a sales call. But how do you convey to them that you really care? And I think hanging up the phone saying, we're going to check your insurance benefits and call you back is one of those ways where you lose the ability to be compassionate, right? You're not segmenting it to, oh, well, great, active coverage. You're not, I've validated that you have at least active coverage. Cool. It might not be the best policy, might be a great policy. We're not talking about that right now. At least I know that we're on the right track. Let's dive into what's going on with you. Let's go into your screening assessment. Let's dive into the meat and potatoes. As that person feels a little bit more cared for. So I mean that's really where most facilities seem to be going to, and I can't believe sometimes how many folks I speak with on a regular basis that don't think that way and that operate more on, all right, send me your verification card. I'll call you back. I don't want to ask for your
Forget HIPAA. Let's just text it over, right?
yeah, just put your card on the table, get your cell phone, take a picture, text it to me. I'll help you out. I'll do you a solid, right? Like, and I mean, talk about billing. I don't really have any insights on billing, but it's pretty important. Like
You said something that was really interesting to me, and I don't want to forget it. You said something along the lines of using technology to make things more seamless.
Yeah.
And I think that's fascinating because what I've seen over the years is people rushing for speed, right? Like I want to get that card texted to me from the client to my admissions team to verify to back, because if I don't, someone else will, because what treatment centers are really doing is they're sending out these jump balls to 5 different places and see who gets back first.
Yeah.
Which we don't have time in today's call to talk about like why that needs to go away. Like that's, I write an article on the jump ball, but they're rushing for speed. But your point's really interesting because that's actually not creating more speed. It's creating more steps is what it's really doing, right? It's saying, hey, we're going to create these 6 steps and we're still not going to have a person who's in need, in crisis, ready to go to treatment. We're just going to have an answer to a solution. I think it was Henry Ford that said, if I listened to my customers, I would have built a faster horse. And the reality of it is that wasn't what the solution was. It was technology to make things more seamless.
Yeah.
So I find that
crazy.
really, yeah, it is. It's almost counterintuitive to the people who are doing that work on a daily basis because it's hammered in every day, right? Like make the phone ring, send a text with the insurance card, don't build clinical alliance, see what Availity says and move back. When, one of the reasons I like you guys, your product and a more client-centric approach is it takes a lot of money to make the phone ring. It doesn't take a ton of money to pick it up and do the right thing and get a person into treatment. But so many treatment centers are focused on the trees instead of the whole forest, right? And missing the view.
Training, quality assurance, and I challenge people, all the time. Like we don't have any contracts. So, that's one of my things. I was talking to somebody today. He's like, you know what? I really like that you don't have contracts. They've been our customers for years, but they're like, we've tried a lot of other stuff on the side Like, okay, well, you still have been paying us this entire time. And he's like, yeah, and we're going to keep, now they're going to move to Salesforce integrations. It's like, great. You know what I mean? Like, this is more, and I was the one that pointed out, someone was like, y'all are great customers. Y'all have a huge volume. Why aren't y'all making your lives easier for your admission teams? Like, we have an app for that, and the speed, right? Quality assurance, listening to these phone calls, because if you can take, hey, all right, let me send me your insurance card. I'll call you back, versus that compassion, that care, and helping that person understand that they're not just another number. Don't just take a ticket. You know, you can walk them through, and if they're not qualified with health insurance, why are people scared of money? I know the value of when I work for a treatment center. If it's going to cost $20,000, then I'm going to be able to convey that with uh, confidence and not be afraid of that dollar amount. And I'm going to be able to share with them exactly why, if they choose to pay out of pocket, or to maybe even finance their care, why that might be more important than them using their Medicaid to go to a state hospital. And it just baffles me of why that seems to get trained out. Oh, HMO, sorry, can't help you. Bye.
Right.
You're skipping over a huge. They're making assumptions, and we always know the assume, right? I'll save the audience, but if you're going to make those assumptions, assume the close.
And it's interesting. Based off my historical numbers, about 5 to 10% of those will cash pay.
Yeah.
And I think, and for the audience, like, I'm a firm believer that business acumen and altruism are two wings on the same plane in what we do. So if you truly believe in your program and the person is a true clinical fit, why wouldn't you give them the opportunity to go to your program? The missed opportunity on training, to your point, that I always see, and someone uses a product like yours and they say, hey, it's a $10,000 out of, they only cover $10,000. We need $10,000 up front. Why aren't we saying, good news, your insurance covers most of it. We're not picking, well, all we need is 10,000. We don't need the full 30. We don't need the full 50. It's a negative. It's another reason for the person in need and crisis to say, oh, I guess recovery is not for me. I'll go back to this because I don't want to spend 10,000. No one takes my insurance. Like, we're supposed to be hope dealers, right? We're supposed to be out there giving people opportunities, and that treating of that negative conditioning is brutal. It truly is.
It's real.
Yeah, it's real. It's pervasive. But how do we get it better? I mean, obviously training is one thing, but how can we inspire? Like, what's the next step for this industry to say, okay, we've had a consolidation. We're supposed to have the sophistication. The technology is clearly improving. I know that for a fact. Our technology opportunities in this space, and for someone who's a massive tech nerd, like, I've been ecstatic as AI has been growing, as new opportunities grow. How do we get our treatment centers to say, hey, this front end is such a valuable opportunity for us to get the right patients who are in need, who are a clinical fit for our program, into our program, so our amazing therapists and psychologists, psychiatrists can treat them.
Yeah. I was actually on a team meeting this morning, and I call myself out all the time. Like, I'm in sales, and I know I don't always sell the best. Like, I try to highlight what is working, what doesn't work, and I see some of our our BD. I see some of our even like support. I think we're always in sales and talking about it, listening to our own calls. Having some of the training, being aware of some of our flaws. We're all human. Saying it's just really diving in and being like hyper focused, hyper aware of the mission. And I think that was one of my successes from being an admission coordinator, is that I was always looking to improve that journey with those families. I wasn't afraid to stay on the phone for 30 minutes. I wasn't afraid to stay on the phone. I wasn't afraid to call them as a follow-up. I remember one time it was like a day counter from when they first call to when you get them into treatment, and it was like 650 days. You know,
Wow.
that mom knew my name, and I think he went to like 2 or 3 other places, but guess what? When the time came, she called me, and that was just out of something they could do. And I think the margins happened in the outbounds where that was the extra 15%, 20% on some of the months that, you know, might not have been as busy. But you start training people, and of course, that's not the average admission coordinator, right? We come from a time where I was doing my own phone verifications. I might have to call the insurance company and get my own single case agreement. I'm thankful I don't have to print out every PDF and sign it and scan it and shred it and upload it and fax it to somebody else. And some facilities still do that. So sophistication is, I guess, comparative depending on where you work. And but it's training. It's you believing in your program more than anybody else, because if I don't get you to my program and I don't believe in what I do, somebody else is going to get you there.
Mhm.
They're going to call. Remember in print advertising, you can go to Google and search anything, and there's a million companies. You can just go down the list and just call all day. I can keep people busy. I still know people in print advertising that solely are on Yellow Pages and Google. So I think that's that conviction, right? And that can be trained. You can show people and have them adopt your beliefs if they see the passion, if they see the fire, in leadership. So I think that's the a piece of the puzzle, not necessarily the full boat.
Is
Is
Yellow
that?
Pages still around?
I have no idea.
I actually, fun fact, when I was young and needed money really bad, I delivered the phone books door to door.
Oh
It was
man.
legit nickel a phone book. And I'll never forget how terrible that was. My car suspension like dropping low, like the whole thing, because I was still interviewing. I just moved to Charlotte from Connecticut and I had to find a job. I was like, I need to make some money.
Oh,
The worst. It was the worst. I wish I had a step counter then. I wish I had a pedometer, because car to doorstep, car to doorstep. And they said they were going to call a few of the houses to make sure they got them to check. I don't think they did. I'm pretty sure I could have got away with it, but yeah, I did the whole Jeep filled to the brim with Yellow Pages. I would not recommend that.
man. It's probably how you got the abs.
Back then,
Calorie
yeah,
deficiency.
hus- hustling the Yellow Pages, right?
Yeah,
Uh, no, I
that's
mean, yeah,
brutal.
you're, I remember I had some cases myself like that, and I had a young lady who desperately needed to go to treatment, worked with the family for 6 months. Then finally one day the dad says, man, I just wish I could put her on my insurance. I said, well, what are you talking about? Oh, I have Aetna. I'm separated from my ex-wife. We didn't tell you that. And turns out Aetna was a well accepted policy and able to get him in. And it was just like that moment, I was like, oh, 6 months and 2 arrests and all these things we could have done for this young lady, just because the people didn't know what was available. And
Yeah.
it was brutal. So what comes next? What are you guys verified treatment seeing on the horizon? What's the changes that are coming that we need to prepare for, technology or otherwise?
More on the consolidation side, you know, I'm really hopeful. Again, like everything we have is interoperable. So I hope to be, kind of connecting with some of these other players in the field that maybe are interoperable. Maybe we just haven't worked together in the past, and just kind of be cohesive, right? The mission is healthcare, and I think everything has to be somewhat client centric, and really trying to align like our strategic partnerships in a just a very thoughtful phase of our growth, and kind of going from a behavior health only company to somebody that can hit other verticals, and that isn't really just in one niche. We want to be a bigger part of more facilities, because again, infertility. I've talked to a guy that does like rare med, and there's just such a need for good data. I mean, high dollar, right? Very risky, but people's lives are on the line. And so I know one of the really cool things, which who knows when it's going to happen, Medicare is calling for pre-authorizations to be digitized. So if you can imagine, almost a admission coordinator being able to do all facets and almost just click a button and be pre-authorized. So better, even more data, right? Digging further into the data and being able to deliver it. I know AI is, a buzzword, and EIV, and we've kind of taken a funny approach to EIV. There's been a lot of damage done, I think, to folks like, or gun shy, just because, which is expected insurance value for the folks that might not be familiar just with the buzz term. So I see us really building out our own like internal claim status, because in localizing claims information, kind of see what you've gotten paid, is really the only way to get accurate expected insurance value. And because you could be in a zip code right next to somebody, Charlotte, North Carolina is going to pay completely different than Nashville and then West Palm or Costa Mesa. So just being in a different zip code can change how much you're going to get reimbursed on a number of policies. So it's not always the most accurate with some of those ones that are more aggregated across the whole country, right? Not really localized.
Let's delve into that real quick. So I want to give an example, and if you can explain it to people listening, because this is hyper confusing for a lot of people in the space. I've been doing this now almost 11 years, and I'm still not completely fluent in this. So the example I have is there was a policy that I once would bring in from Oklahoma. It was a blue, low copay, which was fantastic. And after 30 days of treatment, the treatment center that I represented would get about $16,000 worth of reimbursement as a Florida-based program. Fast forward a couple of months, New Jersey-based program, exact same policy from the exact same referral source from the exact same part of Oklahoma, $3,000 per day for detox. And then the entire 30 days was going to end up being a $60,000 or so reimbursement to the treatment center. Same patients, same referral sources, slightly different market. Can you talk a bit to that, and why? How would someone know, like, what goes into that concept?
Well, check out the use case. Now imagine you're in Charlotte, and you're like, and maybe a company takes the aggregate of those two. It's like, all right, well, on average, it pays $40,000. Well, the Florida facility is going to be pretty upset if you tell them 40,000. And the New Jersey facility is going to be, woohoo, yeah, like, this is great. So in my experience, and I am not as knowledgeable in this, but it does have to do with how many facilities are in the area, how many claims are going. Let's keep in mind that a health insurance company is a risk stratification company. They're risk mitigators. Their job is to not pay claims. You pay them a set fee, right? That's your contractual. Look at the car insurance, right? Geico is not in the business of letting you wreck your car every week.
Right.
And hey, new car for you. So that's really what we're looking at is, you may have an exchange policy, right? That exchange policy might now have to be on the hook for $60,000, and many different avenues to take this conversation, but collecting patients' financial responsibility, that's huge. That's a huge profit center that if you only owe 5,000, we'll just waive it.
Yeah.
Why?
Not okay.
Why would you do that? And that's somebody is contractually obligated to their health insurance, and that includes their deductibles, their out of pockets. Again, it comes back to being scared of the money, right? Now you think that, oh, little Joey's, but and I've found this out, right? People buy off value, not off of price. So, if they really like the Sentra, or they really like the whatever, don't have any really good analogies right now. I'm out of blanks, but I'll keep it clean and not not even have to use analogies. If you can explain the value and what you're doing different and why that person would want to spend that extra money, usually it's like, oh, okay, I'll pay more for the I'll pay more for your coffee. I'll pay more for your hamburger or whatever. It sounds like a better hamburger, you know, it sounds like you make it better. Would you pay more for a McDonald's hamburger or you pay more for a Chili's hamburger, right?
Chili's is pretty great.
Chili's, you know, you sit down and, you know, I don't know, whatever, watch a game, who knows? Um, so I think that really depends on where you're located, what's your competition, what the market's looking like, and everything is set off Medicare. So Medicare rates, you can look them up. Everybody needs to stick to a Medicare multiplier rate. Like, so if your Medicare multiplier rate being in an out-of-network facility is 5 times Medicare, right? Every service you provide is times 5 of what Medicare says it is. Doesn't mean you're going to get reimbursed on it. So you're going to have the billing and, you know, of course, the balance bill of whatever, you know, if you're in network, out of network. I think a lot of more places are going in network. And I think the economies of scale are really going to affect with Medicaid too. So I see that as being a challenge that a lot of out of network thinking business owners and facilities are going to have to adapt to. Is they're going to have some, they're going to have 1 foot in, 1 foot out, right? You're going to have some in network contracts. The better in network contracts that you can get and negotiate, it's all negotiation, which lead us back to the acquisition, M&A type mergers and acquisitions, is that you're either going out on your terms or you're going out on somebody else's. You know, it's either a buyer's market or a seller's market, you know, and so it really kind of depends on how you posture yourself and how you set the stage.
Yeah, so I think you bring an interesting topic because that's something that a lot of people who are going to watch this don't understand. As business owners, it's very important to understand that the strategy to go in network is a strategy, but it's not the only strategy. And I think for simplicity, our industry is just parroting the concept that we all have to go in network, we all have to go local, no one's traveling for treatment, out of network doesn't work. Well, that's simply false. Because to your point about value, I'd say the majority of our consumers of addiction treatment are looking for the best place that they can go or their loved ones can go that they hope will be a one-time trip. That's it.
Man,
and
yeah.
From the business owner standpoint too, knowing which markets might have these policies that will bring that Oklahoma to Jersey for you, where you have the better reimbursements, just due to the regionality and nationality, we have a lot of people who are expanding their programs, right? They're expanding their outreach teams and they willy-nilly pick markets. I remember one time I was expanding an outreach team and I had a board member say, I would like a person here and here. I said, why? And there's so many million people here. I'm like, well, true, but there's a layover between here and here. So we're going to lose people and layovers. It happens. It's unfortunate. The insurance policies there don't pay well over here. Like there's a whole lot into it other than just there's 6 million people in this metro. We're in this metro. Let's try it. So I think that's all that sophistication, education that, you know, especially a product like Verified Treatment can say like, hey, we're going to work with this information and we can help your organization make better front end decisions to fuel that. And then it's all that cyclical, let's all keep this conversation and knowledge going to expand, improve, and continue that knowledge base. So very fascinating stuff, very complex stuff. But if I'm running a treatment center, that's something that I definitely want to be aware of.
Yeah.
So Jordan, in closing, is there anything in particular you want to say to a CEO, executive director, or treatment center owner watching this about your product or anything verification associated that they should definitely know before we wrap?
No, I'd love the chance to have those conversations and dive into it and, have a more strategic call on what's working for them and if there's a spot for us to be good, to be a good partnership. Again, having no contracts and having, no commitment or month to month, is pretty nice when you can say that, hey, people have still been with us since we've started, and they have a free out. So we try to do good business because it's the way to do good business, not because we're looking to collect your money by not working. So I think that's the best intro that I can do, is that if we can meet and chat, that's where it starts.
Well, be sure to find Jordan and Verified Treatment on LinkedIn and all the socials. If you've watched this far, thank you. I appreciate that, humbly. Tune into our next webinar and have an awesome day. Thanks so much, Jordan.
Thank you.
That's a wrap for this episode of The Lead Climb. We hope you picked up some valuable insights to help optimize your patient acquisition and grow your behavioral health organization. If you found today's discussion helpful, be sure to subscribe, leave a review, and share this podcast with your network. And if you're looking for expert guidance in digital marketing, admissions, business development, or any other piece of the patient acquisition puzzle, Growth Sherpa Consulting is here to help. Visit us at www.growthsherpaconsulting.com. Thanks for tuning in. We'll see you next time on The Lead Climb.